Welcome to Wednesday's edition of COVID-19. Now, as is the case midweek, Korea's daily tally has marked a rebound back to the 500 level amid sporadic clusters nationwide. And against this backdrop, questions remain over the necessity of inoculations for those who have survived their bout with COVID-19. We have details later on. We start now with the pandemic updates with our Kwon So-ah. Now, So-ah, let's begin with the surge here in Korea.
Sure, Sunny. It was kind of a predicted incline given that it's a Wednesday. We've got 545 new infections reported as of 12 a.m. And with that, the number of domestic transmissions has also risen to the 500s. And the total number of cases in the country stands at 149,191. What's good to see, though, is that we've got more than 700 new recoveries, raising that total to above 140,000. And let's take a closer look at our map. We are seeing quite a surge in the capital region, with the capitals Seoul and Gyeonggi-do province both close to 200. And also there's been a surge in Daejeon with 29 new infections. So with that, we are back to the 500s after we had 300s for 2 straight days. But if we take a look at the figures on Wednesday in the past month or so, we are actually seeing a downward trend here.
Right, and so as you predicted earlier on Tuesday, that is, Korea has offered at least 1 dose of the COVID-19 vaccine to more than 13 million people. Is this pace expected to continue?
Yes, Sunny. The government's goal of vaccinating at least 13 million people with at least 1 dose was achieved on Tuesday afternoon. And as of 12 a.m. this Wednesday, that figure now stands at 13.2 million, and that's equivalent to around 25.7% of the country's population. And as Sunny predicted, vaccinations are likely to speed up even further, with the government set to announce its 3rd quarter inoculation plan tomorrow, which would be Thursday, and which is expected to include people aged 18 to 59, and those in their 50s likely to be prioritized among that age group. And also the Janssen vaccination for military-affiliated people is expected to come to an end this Wednesday. And along with the progress on the vaccination front, citizens can look forward to relaxed social distancing measures to begin as early as July 5th. But to be on the safe side, officials are actually planning a transition period of 3 weeks before these new relaxed measures fully set in. So let's take a closer look at what that means. That would be from the first Monday of July until the 25th. And under that plan, private gatherings in the metropolitan region will be allowed for up to 6 people from the current 4, so not a sudden shift to 8. Outside the capital area, the limit is to be set for 8 before restrictions on private gatherings will be lifted altogether. Also in the greater Seoul area, nightlife entertainment venues that currently are suspended are expected to be allowed to open until 10 p.m., not midnight, as is predicted to be eventually the case with the revised social distancing scheme. Authorities have high expectations for the new measures, but also remain cautious.
3rd quarter vaccinations and a revised social distancing system will bring us a step closer to returning to our daily lives. But we must not lower our guards. In the UK, more than 60% of the country's population have been vaccinated with at least 1 dose, but it has extended its lockdown for another month due to the fast spread of variant cases.
Where lockdowns are no more is in California, which has lifted almost all of its remaining virus restrictions on Tuesday local time as part of its full reopening of the state's economy. And meanwhile, in Israel, Tuesday, the country lifted its rule on indoor mask wearing with the exception of a few places, and that as daily cases are near 0 now. And last but not least, let's take a look at the global figures now. Although the U.S. is seeing decreases in daily figures, its death toll has surpassed 600,000, and that's equivalent to its yearly cancer death toll. Meanwhile, we are seeing a decrease in India with around 62,000 new infections, while the UK here at almost 4.6 million is still seeing over 7,000 cases, and that due to the Delta variant. And Colombia down here has 3.8 million cases in total, with a rise of 24,000 in the past 24 hours. And the total number of infections around the globe stands at 177.4 million. And we're also seeing a rise in daily fatalities, which were below 10,000 on Monday and Tuesday, South Korea time. And those are the updates I have for now, and I'll toss it back to Sunny.
Right, so thank you as always. I'll see you on Thursday then. Right, now for more local coverage, including details from Tuesday's afternoon briefing, I have G. Abby Lee here in the studio with me today. Welcome, G.
Hi, Sunny. So Seoul didn't start the nationwide vaccination process as early as, say, the United States or Israel, as you know, but once the campaign began a few months ago, it's been happening at a lightning speed. Thanks to the effort, the number of COVID-19 cases among Koreans over the age of 75 have plummeted. The vaccination rate for that age group is now at a whopping 90%, thanks to the Korean government prioritizing vaccinations for the elderly. This has also led to a decrease in the overall fatality rate. Compared to the last week of December, the infection rate in the second week of June has plunged from 16 to 2 for every 100,000 people. Let's hear from a top KDCA official who presided over Tuesday's briefing.
We're seeing a clear decline in new infections due to a higher vaccination rate among citizens aged 75 and above. And this shows that the vaccine is working.
Right, and that is, of course, encouraging to know. Meanwhile, on a worrying note, though, I understand there's been a rise in the number of cluster infections at cram schools here in the country.
Yes, that's certainly correct. The regular briefing also touched upon that issue of the outbreaks at hagwons, as private learning institutions are called in Korean. Let's hear back from the KDCA official.
A total of 50 cluster infections have been reported at cram schools since January, accounting for just over 8,000 cases. We speculate that these transmissions were fueled by the enclosed environment at these venues.
A cluster infection at a hagwon in Gimpo, a small city west of Seoul, was confirmed Tuesday, leading to 190 cases. The KDCA simulation of air diffusion in that specific building shows small droplets from an infected person's nose or mouth easily spreading to the entire area within 30 seconds. This is why the agency emphasized a trifecta of COVID-19 prevention: masks, hand sanitizers, and ventilation. The KDCA director said it's crucial to open all windows and doors fully for at least 10 minutes in between classes, in addition to running circulation fans equipped in the buildings.
Right, and that goes to show how simple habits or practices go a long way in limiting transmissions. One final question, Ji. What is the latest with regard to variants here in the country?
So, as I mentioned last week, South Korean government is analyzing the new variants at a much higher rate than the rest of the world. In the past week, it conducted genome analysis on 16.5% of the new variant cases found in the country. A total of 631 cases were analyzed over a 7-day period last week, and 226 were identified as variant cases, or 36% of the total. Among the newly confirmed cases, the Alpha variant is still the most prevalent, with 192 cases. The Delta variant is the second most common, with 30 cases, and this is a variant people around the world are most worried about.
The Delta variant spreads extremely fast. In the UK, for example, it could become the most dominant coronavirus strain in that country in just 2 to 3 weeks' time. That is why we need to proactively monitor this variant.
The silver lining here is that the vaccines are effective against even the new Delta variant once the second inoculation is complete. The first jab alone is not enough, but once 2 doses are given, vaccines become 60 to 88% effective. The vaccines also lower the rate of serious illnesses that require hospitalization by up to 96%. That's all from me today.
All right, Abby, as always, thank you very much for that.
Thanks for having me.
On the international front, a top health authority in Norway recently declared that the COVID-19 pandemic in his country was over. Now, the declaration was received much media attention. And for more on this, I have Dr. Ernst Christian Rødland at the Norwegian Institute of Public Health live on the line. It's good to see you again, Dr. Rødland.
Thank you. Thanks. Same back.
Right, Dr. Rodland, let's begin then with the words of the chief physician at the Infection Control Division at your institute, who recently claimed that the pandemic was over in Norway.
Well, what happened, it was an unfortunate incident actually, but what happened was that my colleague, he was having his morning coffee a Sunday morning a week and a half ago, and he was at the same time looking at the new numbers in Norway. And he was so excited and enthusiastic about it, and so optimistic that he wanted to share this optimism to his fellow citizens in Norway. So he made a tweet, and he wrote that tweet in the sense that you could understand that the pandemic was in past tense, so that it was something that was over. But it has never been the intention for the Norwegian authorities or government to declare the pandemic over. And as a matter of fact, just later the same day, top officials in Norway from the Director of Health and the Norwegian Institute for Public Health, and also the Prime Minister and the Minister of Health, all corrected this statement actually, and also my colleague did as well. So it's actually only a misunderstanding, and I guess it's a lesson learned for people in our position to be careful what we say on social media and on Twitter as well. Right. So that is the situation, and the pandemic is, as of today, not declared over in Norway.
Right. But regardless of that, compared to its neighbours, Norway has been weathering the pandemic better. Dr. Rodland, what is the current COVID-19 situation in Norway then?
Well, it's very positive actually, and we are all optimistic. I was just listening to the update of the numbers in Korea now, just on your show, and I would say that we are some weeks ahead of the Korean situation. The case now is that we have had approximately 120,000 cases in Norway. The numbers are falling by approximately 20% a week at the moment, and we have somewhere around 50 people admitted to hospitals because of COVID-19 in the whole of the country, and very, very few deaths. So the whole situation looks very positive, and we are confident that when we have offered vaccine to every person above 18 years old, we will very soon see the actual end of the pandemic. In Norway, that I have to say, not globally, of course, because that's a completely different story.
Right. And speaking of vaccinations, Dr. Rodland, how is that campaign proceeding in Norway?
It's proceeding very well. Our challenge is actually to get the vaccines imported to Norway. But as soon as we have the vaccines within the borders, we have an efficient system to roll them out and to vaccinate the population. As of today, it's almost 40% of the total Norwegian population, that has received at least one jab of the vaccine. And a little bit more than 25% are fully vaccinated today. And I guess that's what's reflected in the very optimistic and positive numbers as well, that we see falling rates in all parameters that we survey.
I see. And given that reality, Dr. Rodland, what has been shared thus far by authorities in Norway about the necessary documentation to facilitate travel within Europe after vaccination?
Well, this is the vaccine passport, I guess, that you ask about. And it was rolled out in Norway on the June 10th. And it's been a lot of debate and discussions how to actually use it. What can we use it for? In Norway, it's for attending different arrangements, concerts, stuff like that. The challenge in Europe is that different countries in Europe have different rules and cut-offs, different time limits, and also it's important to find some sort of solution or offer to people that are not vaccinated, so they won't be discriminated upon. But we are also in the loop of using the vaccine passport, which was rolled out the 10th of June, for travel within Europe as well by the 1st of July.
I see. Right, Dr. Rodland, one final question then. In your opinion, what conditions need to be met before a country can declare an end to COVID-19?
Wow, that's a difficult question actually. Yes. But it's I think it has to be reflected in the actual numbers of new cases and fatality rates, etc. So I think of course, vaccination and eventually natural immunity for those who get infected, that's the key point for the solution of this. And that's what I think we will see in Norway within 3, 4, 5 weeks with more and more people being vaccinated. And we will see the numbers are plummeting, and then we hopefully can declare the pandemic over in the sense that it will ever be over. But that's what I think. Yes.
Right. We'll have to wait and see then. All right, Dr. Rødland, thank you very much for making the time to join us live at this very early hour to end.
That is fine. That is fine. Thank you very much for inviting me.
Right then, back on the local front, unmanned stores are garnering greater popularity as owners appreciate the cut in labor costs, while consumers enjoy the no-contact service amid concerns of COVID-19 transmission. We have more in this report.
The COVID-19 pandemic has reshaped the shopping industry. According to Statistics Korea, the number of businesses with employees decreased by 158,000 compared to last year, while those without employees increased by 32,000. Such a change helps business owners to cut labor costs, and it leads directly to more startups. It began with unmanned laundromats, and now we see unmanned convenience stores and cafes.
It's been well over a year since the pandemic broke out, and with that, unmanned convenience stores are no more new to us. And now that idea has been expanded to other areas, and today we're about to see South Korea's very first home appliance stores.
Before entering the store, customers need to scan a QR code for self-authentication. From 8:30 p.m. to 12 a.m., this home appliance store turns into an unmanned store, making it the first electronic store in South Korea to do so.
최근 들어서 좀 언택트 시대의 비대면 쇼핑을 원하시는 소비자들의 요구에 발빠르게 대응하기 위해서 무인 매장을 오픈하게 되었습니다.
It provides unique experiences to consumers, allowing them to freely look around a store, and the kiosks in the store will answer to any questions regarding the products.
So using a kiosk here, you can locate the products that you're looking for. Also, you can find detailed information about the products such as promotions or the prices.
Because of the high price, some people rather prefer to visit the store to take a look at the actual home appliances than to purchase it online. And they find these unmanned stores very useful.
인터넷으로만 보던 것들을 실제적으로 직접 체험할 수 있어서 좋았던 것 같아요.
일단 늦은 시간에 와서 봐도 되고, 일단은 다른 고객들도 많이 없으니까 한 제품마다 이제 충분히 둘러볼 수 있어서 좋은 것 같아요.
So now another unmanned store that we're going to check out right now is a clothing store. Have you ever experienced that moment that you want to buy some clothes, so you hang around in front of a store, but then you don't really want to get in there because you're feeling uncomfortable for some reason? But at here, you don't need to worry about that.
In this store, unlike any others, you can find a hand washing station. To prevent the spread of the virus, customers are asked to wash their hands before shopping, and after that, they can freely look around and even try clothes on. When you need help, you can call employees working next door by pressing a call button, and to purchase items, you can use the kiosks in the store.
작은 옷가게 같은 경우에는 굳이 살 게 아닌데 가서 편하게 구경하기에는 좀 어려울 때가 있는데 여긴 언택트 매장이고 제가 필요할 때만 요청드리면 되니까 또 애기 데리고도 오기 편해서 오게 되었습니다.
All you need to do is just scanning the barcode and then just decide whether you want to take it right away or rather use a delivery service.
요즘 무인으로 된 매장이 조금씩 생기고는 있는데 그래도 여성 의류, 그러니까 이런 의류 매장 같은 경우는 좀 아무래도 처음 접하시다 보니까 굉장히 좀 신기해하시고 재밌어하세요.
소비자 입장에서 말씀을 드리면 이 무인 매장은 그 시간의 편리성이 극대화된다 이렇게 볼 수가 있어요. 오늘날의 소비자들이 굉장히 빨리빨리 원하거든요. 따라서 문 매장은 비대면이면서 동시에 자기가 원하는 걸 즉각적으로 얻을 수 있다라는 장점이 있기 때문에 온라인 쇼핑이 늘어남에도 불구하고 무인 매장은 더욱더 늘어난다 이렇게 볼 수가 있는 거죠.
It is so amazing that you can not only buy clothes, but also home appliances in non-face-to-face ways. Conventional stores, coinciding with digitalization and the pandemic, are increasingly turning autonomous. This has been 신세벽.
(25%의) 접종률을 넘어섰고요. 9월까지는 이제 전 국민의 그 70%인 3,600만 명까지 1차 접종을 완료한다는 목표를 가지고 있습니다.
(1회) 접종을 마치신 분은 직계가족 모임 인원 제한에서 제외됩니다. 공원, 등산로 등 야외에서 마스크를 벗으실 수 있습니다.
Over 20% of the global population has received at least one dose of the COVID-19 vaccine, and with this rise in the inoculation number is the rise in the number of those who have survived COVID-19. Now, for more on these two promising realities and their implications, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And I also have Professor Yoo Byung-wook from Soonchunang University. Good to see you again, Professor Yoo. And joining the session virtually is Dr. Shikta Das at University College London. It's a pleasure to have you with us, Dr. Das.
Thank you so much for inviting me. It's a pleasure as well.
Right, thank you for being here. Now, Professor Yoo, we'll start here in the studio then. Over 13 million people in Korea's population of 52 million have now received at least one dose of the COVID-19 vaccine. What are the implications of this milestone?
Well, we can compare the other countries. With a whole the nation, like the England and United States, they have a quarter of the whole population have done the vaccination. Right after that is the decline and reduction of the fatality is the death rate. So exactly we don't know what is the 25% of all population done the vaccination, but this is the one significant thing. Yes, we're going to have vaccinations more and more full coverage as much as possible. The second is 25% the first doses mean is now no more plus infections cases. It's like the Daegu Gyeongbu province is last year. So this is not to the finish because some people say 25% is that enough to cover because who kind of person who not pay but who underwriting the COVID quarantines is like the fail free riding. So 25% mean now just started. So let's focus finished until done.
Right. Meanwhile, Dr. Kim, the number of those people who have survived COVID-19 here on the local front stands at above 140,000, according to our Kwon-soa earlier in the program. What can you tell us about the antibodies, of their antibodies, that is, their level of antibodies, as compared to that of those who have been vaccinated?
Yeah, that's actually a very interesting question. And sometimes the people actually wonder what is the actually major differences between the COVID-19 just survivors and then the vaccine just recipients. And then there are actually similarities and then differences between these two groups. One of the very prominent similar aspect is that both of them actually just express the just spike antibodies. That's the most common thing. And then the different thing is the one thing, well, since when we consider some currently available just vaccines that we are using, those vaccines are somehow just designed to deliver some spike protein. So that's why we are actually just seeing only just spike the protein. But for the real, COVID-19 infection case, there are many other proteins in addition to the spike protein. So one of those things is a nucleocapsid protein. those are actually one of the most abundant proteins in the SARS-CoV-2, these viruses. So one of the actually ways that we can actually differentiate it between these two groups of people is whether there is any just antibody to just a nuclear capsid. If there is an antibody to nuclear capsid, which means that those people actually suffer from the COVID-19. But some other people with some anti-spike antibody, but no just anti-nuclear capsid antibody, which means that people actually just got just the vaccines. And then there are actually some people also an interesting aspect is whether the natural infection actually gives a better protection or just the vaccine actually gives a better protection. But the currently available vaccine seems to just give some better protection against the SARS-CoV-2 infection. And then the reason is I can talk about three the aspects of those reasons. One of them is actually for the natural infection. Viruses, not just only just the coronaviruses, but other viruses, somehow they have their strategy to evade the host immune response. So the natural infection cases, the viruses somehow just inhibit these immune responses from the cells. Somehow they succeed, somehow they are not successful. So that somehow just affect the immune responses of the infected person. So, but in the case of the vaccines, that does not actually evoke such kind of just immune just evasion scenario. And another thing is that the amount of just the vaccine. In this case, the vaccine is basically just antigen. But in the case of natural infection, the amount of antigen may not be really just that high. But in the case of just the vaccine, well, while we are doing some clinical trials, we actually just decide which amount of just antigen or just the vaccine is very appropriate to just raise the immune response. So the amount of antigen is actually better with the vaccine. And the third one is what we can talk about is just a delivery method. Sometimes in this case, mostly it's just an intramuscular injection that actually seems to just gives us a better immune responses compared to the probably in this case some natural infection cases. So those are somehow just contribute to the some better protection due to the vaccination compared to the natural infection.
I see. Let's now then turn our focus at the UK. Dr. Das, what can you tell us about the level of antibodies against COVID-19 among the British public, keeping in mind the reality that over 60% of the population has received at least one dose of the COVID-19 vaccine and that the outbreak there in the UK has been quite rampant?
Yes, absolutely. Thank you for inviting me. And I must clarify that I'm speaking in my personal capacity. As you can see, UK sees a very successful vaccine rollout. Around 80% of adults in UK have COVID-19 antibodies. This figure comes from the Office of National Statistics. And these signs of immunity are from either a vaccine or having a virus in the past. What we observe from the data is that there is a clear pattern between vaccination and testing positive for COVID-19 antibody, which we observe at the moment, and which is something what you would expect as well. In fact, the latest figure in terms of vaccination is nearly 80% in the UK adult who have had at least first dose of the vaccine from the 3 vaccine options which we are given in UK, which is a very good number at the moment.
Right, it is. Meanwhile, Dr. Kim, back here in the country, local study shows 58% of those who endured COVID-19 saw their antibodies last well past a year. Now, what is the significance of this finding? And as a layman, I ask you, is the development of antibodies dependent perhaps on the severity of COVID-19 symptoms?
Well, one of the significance of such a study that well, we actually need to know how long the antibody, especially neutralizing antibodies, last after clearance of the viruses. So then we can actually decide when is the best time to get to give just a vaccination for those recovered patients, and that also somehow affects the
some just interval or just the frequency of the our just booster shot, even for just the vaccine recipients as well. And then concerning the severity of the COVID-19 and the maybe just antibody just a response, I think it is pretty well known now that when the person suffers from severe COVID-19, that actually induces more just neutralizing antibody responses. So that's pretty well known fact right now.
I see. Yeah. Professor Yu, do tell us a bit about Korea's criteria in confirming that a person has recovered from COVID-19, and are these people also being encouraged to get vaccinated?
Well, frankly say, some doctors still confusing about it. Why? From the beginning, we don't have much idea about COVID-19. That time we should recommend to real-time PCR for all who before the discharge or the going back to home from the COVID-19 residence facility. But these days, the criteria in Korea in real is changed. So there are two groups of the patients who are high risk and there are typical symptoms of COVID-19. They should be stayed in a hospital. But the other young, only asymptomatic or the mild symptoms persons who are going to stay COVID-19 facilities, the residence facilities. But at the same time, on the 10 days around, who don't have symptoms anymore, we are waiting for last 10 days, no symptoms, nothing worry, we just release. So have one question for us. We don't need any more the RT-PCR. We don't need any more. Why? When we do the PCR test, coming positive most likely. But this is the part of the COVID-19 virus is not more infectivity. So from the beginning last year, one lady who stayed 87 days in hospital, but it's not happen anymore. Some who are suspicious and who still need antiviral agents or steroid intensive treatment, they will stay a little longer. They use other criteria, but most of the people who got the COVID-19 last 10 days, no symptoms and conditions fine, and 10 to 14 days right after the admits or start to stay in the COVID facilities, they can go home.
I see. And are we inoculating these individuals as well? Are we offering them the COVID-19 vaccine?
Yeah, absolutely. They need a vaccination. What Dr. Kim, he explained exactly. So we have an immune system. Yes, we got antibodies from the direct virus infected. But this work, we don't know exactly. And how long, we don't know exactly. And it helped to against another type of COVID-19 virus. We don't have enough the evidence. So, but we have evidence about the vaccination. Vaccine will help to develop our immune system fight against COVID-19. That's why but only few people who stayed in hospital under special treatment with the antiviral agents and the steroid intense treatment, they can have vaccination 90 days later, around the 12 weeks or 3 months later. But most of the people who are infected, there are not clear guidelines yet, but usually we recommend 4 weeks right after they release from the COVID facilities or hospital, they can have a vaccination.
I see. And staying with that, Dr. Das, what is the stance in the UK with regard to inoculation for those who have survived COVID-19?
It's a very good question, and I would like to first briefly summarize how UK government's approach towards vaccination in this regard. And we have an independent joint committee of vaccine and immunization, which developed the priority groups for COVID-19 vaccines. There were 9 priority groups, and they were based on the highest risk to the severe risk, illness, and death. And this was considered phase 1. And in phase 2, we decided to go with the age group from 18 to 15 who were offered vaccines in the reverse order. So starting from the older group first and then working its way towards the younger group. And let me clarify that the JCVI did not advise excluding or even differentiating COVID survivors in any way. They were treated like anyone else. And in short, that COVID-19 survivors should and are still getting the vaccines like everyone else in UK.
I see. And staying with that, a study over in the US shows inoculations for survivors of COVID-19 further boost their level of antibody protection against the virus. For more on this, I have Dr. Ali Elibedi at Washington University live on the line. Welcome to the program, Dr. Elibedi.
Oh, thanks. Thanks for having me. My pleasure.
Right. Then, Doctor, let's first start then with this question. Are COVID-19 survivors encouraged to get vaccinated in the US? And what can you tell us about the level of antibodies within the US population?
Yes, it's absolutely encouraged for all people, even if they survive the infection, to actually receive the vaccine. We have, as your guests have explained, that we have seen that people who actually have experienced infection, especially mild infection, and then got the vaccine, they have really a boost, a really increased immune response, not only against the vaccine strain, but also against many of the emerging variants. So they have a clear advantage by having this previous infection that produced memory cells that were engaged by this vaccination, and that's made the responses even more enhanced. For the US right now, it's, as you mentioned, we are close to 45% of the population to be fully vaccinated. As you know, we have 3 different vaccines that are authorized. 2 of them are RNA-based vaccines, and 1 is the adenovirus-based vaccine. And we are immunizing people 12 years and older. And I think hopefully very soon we'll start even with younger age. There are trials ongoing at the moment, and that will increase the numbers significantly.
Dr. Elibedi, what can you tell us about the period of antibody protection induced by COVID-19 vaccines?
So that's a very important question. Really, we are really very early we are in early days really to be able to precisely answer this question. What we can say that so far, at least in the 6 months after vaccination, the level of antibodies in blood seems to be good enough or well enough and promising enough to be potentially protective, even against many of the variants. The goal is to see what's the level of these antibodies 1 year after vaccination. What we have done in a recent study is looking at people infected or survived a mild infection with the virus. And what we saw there, the good news is that even after a year after infection, we see a very steady level of the antibodies that are targeting the spike protein of the virus. And those antibodies could be neutralizing and protective. So there is, at least from infection, we see some hope of long-term immunity. The question now, can vaccination match that for a 1 year? And the data will soon be available, at least in the US.
I see. And on your calculations, do you suppose COVID-19 vaccines will be able to, say, match that level of protection in the years to come?
It's really early to tell, hard to tell at this stage if they will be exact match. What we have seen so far, and it's very clear that vaccination especially with the RNA-based vaccines, the immune responses are really robust. So it could be that it's very promising, the data we have seen so far from all the trials so far, that the vaccines, with the RNA-based vaccines specifically, the antibodies and the B-cell responses that are responsible for generating these antibodies are really robust. So there are good signs. I think we should be hopeful, and we are already seeing the impact of vaccination in many places. So I think we should be very hopeful.
Right, and on that hopeful note, I will let you go, Dr. Elibedi. Thank you very much for making the time to join us live at this hour.
It was my pleasure. Thank you for having me.
Right then, back here in the studio, Dr. Kim, is there a difference in antibodies developed depending on which strain of the virus was contracted?
Well, just recently there was a very interesting research outcomes. This is not really just a peer-reviewed article, but there was some report from preprinted servers. They actually studied some alpha variant, just a UK variant on some immune responses, and it's basically just the host responses. This is based on the cell culture experiments. But then so far, many of the actual research is actually focused on the spike protein, because the spike protein is most immunogenic in terms of the vaccines, and also this is the target of the monoclonal antibodies. So that's why it is important. But there are other mutations outside of the spike protein, and then based on their outcome is that those mutations outside of spike protein seems to affect some very early immune response from the host cells, which we technically speaking innate immune responses. Those somehow affect the level of viral RNA, genomic RNA replication. So then I think that study actually does not tell exactly how much effect on the those variants affects the some antibody generation. But I think based on the such impact on the some immune responses, we can just easily just guess that maybe such effect eventually affect the some immune response, just a general immune response, including antibody generation and also some T cell response as well.
I see. And staying with that then, Dr. Das, given the reality that the UK has seen outbreaks triggered largely first by the Alpha variant and now by the Delta variant, what can you tell us about their impact on antibody development?
Absolutely. What we really observe at the moment is, if you look from the risk point of view, the risk of being hospitalized currently with Delta variant is around double than that of an Alpha strain. But as somebody correctly mentioned, that the 2 doses of vaccine is still providing a very strong protection against it. And this is where the antibody plays a very important part as well. As I explained, that 80% of the UK population has had good response to the antibody and with the vaccine as well. And what we really wanted to do here was look at that how vaccine is reducing the risk of hospitalization, and the strong effect against the Delta variant were not seen until the 28 days after the first jab. But we had some good news. The Pfizer and the BioNTech jab was found to provide more than 80% protection against infection from Delta variant, which compared to Alpha variant was just 92%. So we had some, less protection against Delta, but we still have good protection, I would say. With the Oxford AstraZeneca jab, we have 60% protection against the Delta variant and 73% in the Alpha variant. So lower vaccine effect may reflect the fact that it takes longer to develop immunity after having the Oxford AstraZeneca vaccine. But what we also observe is that it is still protective having 2 jabs with any of these vaccinations.
Right, and that, of course, is very encouraging. Professor Yu, those vaccinated are privileged to a host of incentives across the world, of course, now. Do you believe these incentives should also be granted, perhaps, to those who have recovered from COVID-19?
Well, COVID survivor, recovered person. So first of all, government and we have to keep their privacy and the personal informatics, because sometimes some people are put on the stigmas and they can criticize about the person who are infected. They should be protected because they are innocent. Just the virus cannot be avoided 100%. But giving them to certain incentive, as same as like vaccine who are vaccinated, are the different stories. But anyway, we should protect their personal informatics, and we can encourage them to have a vaccinated, and then we can give them the incentives later.
Right, so the intensives will follow vaccination then. Dr. Das, I understand the mask mandate in the UK has been lifted for those vaccinated when outdoors. Does this also apply to COVID-19 survivors?
It's a very interesting question, because UK actually never had a mask mandate in the outdoor spaces, unlike US and several European countries. And the mask mandate or advice was for the indoor public spaces such as shop and public transport. And these remain in place at the moment. As you know that we have extended our lockdown for another 4 weeks. And this, as part of the phased lockdown easing, this mask mandate was only changed for the secondary school pupil, which was lifted in May. And also there's a difference in advice around wearing mask in UK based on the vaccination status or previous COVID history. But there hasn't been any, there is a review at the moment going on about the mask mandate for future. But at the moment, we haven't really heard much more than that.
I see. Meanwhile, Dr. Kim, with regard to measures aimed at ensuring a sense of normality for those who have endured COVID-19, what do you propose going forward, very briefly speaking?
Well, for the general public, I can actually think about any just some general suggestion. Maybe the authorities may just come up with some better just idea. But for the regarding the subject that we have talked about is, as discussed previously, even just the COVID-19 survivors need just vaccination, except that like Dr. Yu said, except for some people who actually given some monoclonal antibody therapy and then convalescent plasma, that in those cases like 90 days after their just a treatment, then they will get the vaccination.
Right, and Professor Yu, what are your thoughts, speaking within your capacity as a health professional yourself, as a doctor, what are your thoughts on measures for those who fully recovered from COVID-19?
Well, so you are safe first, and you are not guilty, because you are recover yourself and back to the society. There are no any mark, there are no stigma. No one can blame to you. Now, time to back to society with us and have a vaccination as soon as possible, as you can.
Right. Professor Yu, thank you very much for your insights. Dr. Kim, thank you for your thoughts. And Dr. Das, over in the UK, thank you very much for your time at this early hour.
It's a pleasure. Thank you.
Right then, while vaccination numbers are picking up pace, it appears that infection numbers across the world are faster. So do seek to stay safe. Thank you for watching.